Hi ladies and gentlemen, it is Charlie aka Miss Charlize, and happy Halloween to you all, of course. I hope that you all have a very fun and entertaining Halloween day. Welcome to the Joy of Gay Sex series right here on the Charlie's Unique channel. And of course, all information is out of the fabulous book, The Joy of Gay Sex, the best-selling guide for gay men. And I'm going to go ahead and do a few topics for you guys today because it is, of course, Wednesday. And right before I get myself absolutely fabulous for the day and go find something to do for Halloween, I wanted to come on and do a few topics for you guys today, of course. And once again, if you have not checked out any previous videos right here on this channel, be sure to go back and check out some of the videos, some very interesting videos to watch. So let me go ahead and Alright, so as you guys know, last week I talked about a video, or one of the topics was how to come more, basically. And I told you guys some of the techniques and tips that I found online to allow yourself to come more. Well, this particular topic I'm going to talk about is problems of ejaculation. You know, sometimes it could be a mind thing, sometimes it can be just you just don't know how to control how you come, blah, blah, blah. Well, this fabulous book is going to explain to you guys some of the reasons why men have these problems and possibly ways that you can fix this issue. So let me begin. This is problems of ejaculation, ladies and gentlemen. There are two kinds of ejaculatory problems: premature ejaculation, coming too fast, and retarded ejaculation, coming with great difficulty or not at all. While people with retarded ejaculation exercise too much control over their sexual responses, those afflicted by premature ejaculation lack control, or rather have too little awareness of their bodily cues. A man who ejaculates prematurely is not aware of what's happening inside his cock, and particularly in the muscles surrounding it. One self-help technique for coming too fast is this: choose an understanding partner to jerk you off at the point of coming. Concentrate on your sensations and be on the alert for signals of imminent ejaculation. When you think you're about to come, tell your partner to stop masturbating you. Once the urge to come has abated, ask him to start jerking you off again. One more stop him when you're close to climax. Repeat this exercise twice more, then go ahead and come. Sex therapists call this the stop-start technique. During the next class, school was never like this. Your partner sucks you off to point just short of climax. When you feel you're about to come, stop him. Repeat 3 times, then come. The final step is screwing. When screwing, the best way to start out is with your partner on top, which of course you guys saw the sitting on it position last week on the show. Be sure to go back and check out that video. He should make slow movements up and down on your cock while you concentrate on your own physical sensations. When you feel that orgasm is near, stop him. Repeat 3 times. On the 4th time, go ahead and come. After you have overcome premature ejaculation in this position, you can switch to the side-by-side position. Always go slowly, which of course the side-by-side position, aka spooning, was on last week's show as well. Be sure to go back and check that out. And remember, safe sex guidelines should always be followed during these exercises. Men who suffered from retarded ejaculation, they come very, very slowly or not at all. Perform adequately until it's time to come, and then they can't. As a rule, they usually have no problem coming while jerking off in the privacy of their bedroom. Other men have no problem coming when someone else jerks them off or sucks them off, only when screwing. The immediate physical cause of retarded ejaculation, it is believed, is involuntary muscular overcontrol. The muscles around your genitalia appear to lock shut, and there is nothing you can do about it, since they are under the control of the autonomic involuntary nervous system. That means that the problem originates, like almost all sex problems, in the brain. It's a common response in men who are extremely tired. This is also true of impotence. But it may also occur in a man who's been screwing for a long time, but trying not to come. He may succeed all too well. In these cases, the problem is situational and not chronic. The deeper psychological cause, however, is probably anxiety, fear of sex, guilt about homosexuality, anxiety about pleasing one's lover, or about giving in to the loss of psychological and physical control during an orgasm. All are possible factors. A number of psychologists also suggest that a strong unconscious hostile element may be involved. Whether anxiety is channeled into impotence, retarded ejaculation, or the inability to get screwed may depend upon one's psychological makeup. An impotent man will become flooded with anxiety. A late comer, by contrast, probably doesn't feel anxious at all. If retarded ejaculation is persistent and long-standing, this exercise should help. If you have no problem masturbating alone, be sure to continue your jack-off sessions. One evening, ask someone you completely trust to sit in the next room while you jerk off to orgasm. The next night, invite him to sit in the room next to you while you masturbate for a few minutes. As you approach climax, he should enter the room but not look at you. The next day, he should come into the room while you jerk off, at first with his back to you, the next time facing you. Stagey and contrived as this procedure might sound, it follows a sound principle. Psychologists call it desensitization. In any set of desensitization exercises, you start with a situation that provokes no anxiety, then slowly move step by step toward the situation that alarms you. In overcoming retarded ejaculation, you are moving from jerking off alone, a relaxed situation, to jerking off in front of a partner. Once jerking off with him in the room and facing you is comfortable, he ought to come closer. And just as you're about to climax, he should take over, the crucial moment, and jerk you off. Latecomers habitually study themselves and watch their partners for reactions. This scrutiny only makes the problem worse. Turn out the light and surrender to your fantasies. Forget about your cock. Forget about what your partner is thinking, and picture a mouth-watering scene. If no fantasy springs to mind, use dirty pictures or a porn tape. As you get caught up in this distracting whirl, your partner should jerk you off to climax. Concentrate on the video or the story, not on what he's doing. On the next evening, he should go through the same procedure. Finally, try screwing him after you're midway through jerking yourself off. Psychotherapy is not especially recommended for ejaculation problems, though sex therapy may be quite useful. Find out the name of a professional sex therapist and consult him or her. If you or your lover have become anxious in your attempts to cope with the problem, you may both welcome the assistance of an objective third person. Temporary problems of ejaculation are notorious side effects in men taking care of certain kinds of antidepressant medications. One of the new classes of these medications is the selective serotonin reuptake inhibitor, more commonly called SSRI. It includes such drugs as Prozac, Paxil, and Effixor. They have been lifesavers for some men, reducing feelings of depression and making life livable again. But the downside is that they lower your libido and your ability to get erect and to come. The higher your dosage, generally the lower your libido. Some men experience all these effects at once. Others still feel aroused, but no matter what they do or how much a partner helps, they can't come. It's a shame some depressed men feel they have to choose between being depressed and having a sex life. Many simply stop taking the drugs. That's a mistake. There are two ways of handling the problem. If an SSRI is effective in treating your depression, ask your doctor for another medication that will alleviate the sexual side effects. If that doesn't work, switch to non-SSRI antidepressant. Wellbutrin is one of the most popularly prescribed substitutes, but don't become worried about your problem of not coming. It's only temporary. Stopping the antidepressant will bring back your usual genital responses. Party drugs present other problems for those wishing to have a normal sex life. Some of the most popular drugs may make you feel good, but your sexual functioning will be reduced to zilch. Alright, you guys, so there's some information just basically about problems of ejaculation, why some men have problems of ejaculating and coming and stuff like that. If you go back on the videos that I presented to you guys last week here on the Joy of Gay Sex series, it gives you a few tips on how you can learn to control your coming and how to come more at certain times. So be sure to go back on those videos. Alright, you guys, be sure to comment and let me know what you thought about this topic. Stay tuned because I have a few more topics here on the Joy of Gay Sex series. Alright, holla back.